Okay, there we go. All right. So my name is Elizabeth Barajas. I'm a staff advisor here at Health Professions Advising at UC Davis. And again, I'm going to talk today about writing your personal statements for your health professional schools. First of all, actually, I would like to ask everyone to put in the chat, which health profession are you planning to pursue and when you're hoping to apply? Okay, so far we have a PA applying this cycle, coming up cycle, MDDOS, yeah, 2025, dentistry this year, PA next year, dentistry this year, DBM this cycle. Oh, good, we have a good variety of people here. OT next cycle, awesome. MDDO 2025, dentistry this coming cycle. Okay. So some of the things that I talk about today are going to be particularly relevant for people who are applying this cycle. Other thing, if you're not planning to apply this cycle, you don't necessarily need to worry about all of those things right now, but just something to be aware of as you head into the next year and application season that starts a year from now. And I wanted to mention too, if anybody has questions throughout the presentation, please feel free to put them in the chat and or raise your virtual hand and just ask the question over the camera. I'll stop periodically and ask if anyone has questions too. Okay, so thanks for sharing everybody, which field you're going into and when you're planning to apply. So personal statements for any kind of health profession are a way for you to show the admissions committees who you are, basically, because they're going to see your transcripts, they're going to see your GPA, they're going to see your test scores if those are required for your schools. But what they're not going to know until they read your personal statement is why you want to be a PA or a dentist or a doctor. They're also not going to know the value that you'll add to the field. So what do you bring? What kind of skills and attributes do you bring as a future fill in the blank? What kind of person are you going to be? Are you going to be the kind of person who can connect with people quickly? Are you going to be the kind of person who can educate your patients and help them feel like they can advocate for their own health because they have that knowledge? And we're going to go into a little bit more about competencies and attributes, but those are things like the medical schools have a list of competencies that they look for throughout people's applications, and we're going to talk about how you can mention those in things like your personal statement. Okay, and then it's important to note what personal statements are not. They're not a resume or a list of your experiences. There's going to be an entire separate section of your application and or a resume, depending on your field, for you to talk about all those things. So there's a separate work and activity section for MD schools. There's a separate section for experiences for any other of the health professions. So the personal statement is where you can dive deeper into stories that tell, show the reader something about you. They're also not a chronicle of your journey towards realizing that you want to go into your healthcare field. Sometimes what I'll read in someone's draft is everything leading up to, and that's when I realized I wanted to be a nurse or a dentist. But often that part is based in childhood or that's based in when you're younger, and they're not going to be able to know what you'll be like in your healthcare field as a practitioner unless you're talking about things that happen as an adult, more recent experiences within the healthcare field or something related to it. So what it is, you can talk about your journey towards realizing it, but you want to shrink that down. So that's going to be more like your introduction. The rest of it is going to go into how you've worked towards what you want to do for people as a dentist or a doctor in the rest of your essay. It's not an explanation of why you didn't do something else. So you don't need to say why you don't want to be a nurse or a PA if you want to be a doctor, or why you don't want to be a doctor if you want to be a PA. But what you can do with that is, instead of saying, I don't want to be a doctor because of these reasons, focus on why do you want to be a PA, for example. And in that is, it's not a criticism of any health field or practitioner, like saying, oh, doctors can't do this, or nurses can't do this, so therefore I want to be a doctor. It's what do you want to do within your field? And it's a place to tell your own story, not someone else's. So I've read a lot about people's grandparents, a lot about their brothers and sisters, a lot about the patients they've worked with, but sometimes they forget to add themselves. So you want to be able to talk mainly about yourself in this essay. You can include other people's stories, but you want to make sure that you are a main character as well in those stories, so that it's centered around how did this experience shape your desire to go into this field, not what kind of care did your relative get and then leaving it at that. It's also not a piece of super creative writing. It's definitely not a poem. It's not going to be like a metaphor for how medicine is like baking, which I've read in people's essays, or how it's like playing basketball or how it's like playing soccer. It's really, you want it to be formal and you want it to be straightforward. You don't want them to have to guess at what you're trying to say. And it's centered around you and what you hope to do in the future. So some important points. I've said this several times, but just want to reiterate, it's going to be about you. Some people, going into writing the personal statement, they say, oh, well, throughout my undergrad, I've been taught not to use I in my writing. And I totally get that. It's very hard to switch away from not using I into suddenly talking all about yourself. But we can help you to figure that out. We can help you to figure out where you can put in more experiences or more stories or more information about you. And so I've kind of mentioned this, but not quite directly. So when you're talking about your experiences, you're going to use stories to show and not just tell what you want the readers to know about you. And I'll give some examples of that, but it's important to use those stories in that way so that you can really illustrate how you have how you've worked on your strengths going into your healthcare field. Ways that you've been able to interact with patients or other people, friends, families, fellow students, classmates. And it's going to show how you'll be with your patients in the future. And a lot of people will be a bit nervous about talking about certain experiences because they think, oh, well, everybody else has those experiences before they apply, which is true. There's only so many things you can do without getting into your healthcare field, into your school. But even if someone has the exact same experience, like say you're volunteering at a hospice and your friend is volunteering at the hospice as well, you could be working with the same person on the same day, sitting with them and talking with them, but you're going to have a completely different experience because you're not the same person. You bring certain things to that conversation that they don't, and vice versa. So that's when you go deep into that story. So that could be an example of, I decided to volunteer at a hospice to create, see how I could create these connections with patients. And one day I sat next to a woman who didn't want to talk. And so I just sat with her and whatever and sat with her until she felt comfortable with talking, and then we started making conversation. I asked her questions about herself. So within that story, you're showing things about you that are valuable to the admissions committee. So I've already kind of mentioned that you would avoid just listing what you did in your experiences because you're going to write those somewhere else in your application. And instead use this space to dive deeper into what you got out of those experiences. And to clarify, all of your experiences are going to go into that section. From those experiences, you're drawing the stories for your personal statement. So there's going to be some overlap because you're going to talk about the same things, but you're going to talk about them in different ways. Oh, somebody had a question. So would the personal statement be very similar to a cover letter? In some ways, it can be similar to a cover letter of saying, it's not just giving someone a resume and saying, okay, figure out how I'm going to fit into this job or why I care about this job. It's going into a lot more detail about that. So to some extent, yes, it could be a bit like that. So I mentioned before the core competencies. These are what medical schools specifically are looking for throughout your application, but I feel like they're very relevant for any health profession. I won't read through all of them, but you can definitely take a look through these. They've changed recently. They've gotten a bit more specific this year. And these are things they're looking for throughout your application. So you can talk about things related to these in your personal statement, in your experience descriptions, and they will also appear in your letters of recommendation, although that's not something that you normally have the ability to write yourself. Sometimes you can, but depends on the writer. And with these, it's also important to note that you don't want to say them directly. So if you're talking about that story about sitting with a woman in hospice and just going at her own pace and making sure she felt comfortable, that would show ethical responsibility of being a volunteer. It would show oral communication, interpersonal skills, being reliable, dependable. Maybe you show up every Tuesday and she gets used to that. Resilience and adaptability, so she doesn't respond the way that you're hoping the first time. Maybe you try something different. And service orientation, definitely cultural awareness or humility, depending on what background you have and what background she has. But you're not going to state these directly. So they're going to show them through the stories that you tell, but you're not going to say, I am culturally aware or I have interpersonal skills. You're going to be able to show that through your stories. Any questions so far? Or any other questions? Okay. So recommendations for starting the personal statement, definitely start early. This is around the time that we would recommend starting if you are applying this year. So then if you're applying next year around January, you'd really want to get into your drafting. Of course, you can work on it before then, but things can change. So then you can, revise as needed. Exactly. Just like I say in the second bullet point here. Oh, I think there are a couple questions. Let's see. So someone asked, they worked in various fields. And talking about all these different experiences. That's a lot of great experiences. You would put all of those into your experience section. Definitely, those are all very valid and helpful for them to see. And then depending on, I'm going to get to the idea of a theme in your personal statement in just a second, but depending on your theme, you could tell particular stories from those experiences that would show, again, the value that you'd bring to your field. But if you have specific questions about those, we can definitely talk about them in an appointment, or I'll stick around for a few minutes after we're done here, and if anyone wants to ask questions. Okay, so if you don't know where to start, try just brainstorming, make a list of 10 points in your life that you think about often, like, something from your schooling, something from an experience that you had in high school or in college, something about your childhood, and then see how these points might be connected and how they've influenced you. And I'll talk a little bit more about that in just a minute as well. Definitely plan to write multiple drafts. I won't say you need to write 100 drafts, but most people write more than 2 or 3, definitely. It's not really something that you can just write and be done with. It's going to take, like I said, multiple drafts. It's going to take a lot of different people reading it, giving you feedback. You may start with one idea and end up somewhere completely different by the end. So just be open to that. And definitely find and use resources to help you. So we can help you at HPA to write your personal statement, to draft it, If you have no idea where to start, we can help you with that too. And we can also help you after you graduate. So even if you've graduated already and you're deciding to apply, we can help you. You can just make an appointment and or come to our drop-ins. And I definitely recommend keeping a journal of your experiences. So note your impressions of these experiences and how they relate to your goals in healthcare. So then any experiences would be relevant here. It could be healthcare related, or it could be something non-healthcare related, like tutoring or teaching or volunteering at an animal shelter, or working at a restaurant even. There's a lot of crossover with skills that you gain in any kind of experience that are going to be relevant to any kind of healthcare field. So you can definitely keep track of those in a journal. And it would also be helpful in the future once you become a nurse or a doctor or a dentist to look back and see how far you've come. Okay, so then I mentioned themes very briefly, but themes in general are beneficial to your essay because they provide a focus. So to be a bit more specific about what a theme would look like, it's something like, I want to be a dentist so that I can provide oral health education to my patients and help them to understand the importance of preventative care. So within that, we can guess that this person is going to talk about education. Maybe they've been a tutor, maybe they've been a learning assistant, maybe they've been a teacher somewhere. Maybe they've tutored chemistry, or they've tutored kids, or they've taught kids how to play guitar. Any of those things are going to be relevant to that kind of theme. So that's how you can choose from all of your experiences based on your theme. And then within even those experiences, then you can think about which stories from those experiences would show your skills the most and the best. And of course, along this whole path of figuring out which stories to tell and how to tell them, we can help you with that at any point. They also help you to avoid creating an essay that's just a list of what you've done in your life, or that tells your whole life story, which is not what you want to do in your personal statement. And I think kind of related to what I was saying, they can help you think these experiences that build on one another to show the reader who you are, what you care about, and the value you bring to healthcare. Now, that said, some of you might be thinking, well, how do I come up with a theme? That sounds like a lot. And it can be difficult, but we can definitely help you as well. Sometimes having an outside perspective can be really valuable to, maybe we look at your experiences and we see a particular trend that you may have missed or just not have recognized. So help getting that kind of feedback from other people can be helpful as well. So definitely looking for those concepts or patterns that you can see that run throughout your life. Maybe you have a focus on education, or you've had a focus on education for a long time. Any past experiences that parallel with current activities. So going back to that example of the person who wants to be a dentist so they can educate their patients on oral health, maybe they start with a story of either them as a child getting dental care and having that kind of education provided for them, or maybe a family member or somebody else where they saw this is what dentists can do. And then they thought, this is what I want to do. It could also be, it doesn't have to be necessarily something from childhood, or it doesn't have to be that light bulb moment. I feel like most people I've worked with don't have a light bulb moment. They just, looking back, it makes sense that they've been on this path the whole time. But what's he saying? So I was saying like they would, it could, so it doesn't have to be like where it first began in the sense of like, I've wanted to be a dentist since I was 5 years old. You don't necessarily have to talk about that. It could be maybe you were shadowing a dentist while you're in college, or working as a dental hygienist, or working in a dental assistant position, or just whatever, being a patient as an adult. And experiencing that then. So maybe you already knew you wanted to go into dentistry, but then you were able to see more specifically why you want to go into dentistry because you saw this dentist provide that kind of education to their patient. So that could be like the story that you start your essay with. And then you go into a statement by the end of that story of, based on this experience, I decided I wanted to be a dentist so I could do all these things for my patients. And then the subsequent paragraphs could be, you know, in order to explore education, I decided to become a chemistry tutor through the AETC at UC Davis, where I did XYZ. One day somebody came in who was completely lost and didn't know why they needed to take chemistry, didn't understand it. So I sat down with them and guided them through the process of learning what they needed to know. Of course, you want to go into more detail than that, but that would kind of show like that parallel. So it's any past experiences that parallel with current activities. That would be a good example of, I saw a dentist do this whenever it was, and this is what I've been able to do for my two T's. And then maybe the next paragraph is something from them working with patients. um, any questions about any of that, about themes or anything related to that? Okay. So depending on your field, the length of personal statements is going to vary. Um, Allopathic medicine, meaning MD schools, osteopathic medicine, meaning DO schools, those are both 5,300 characters. And these are all with spaces. Definitely emphasize that. If you do it without spaces, it'll seem a lot longer. But if you do the count like in your Google Doc or in your Word doc, it's going to be a bit shorter with spaces. Podiatric medicine is 4,500, PA is 5,000, veterinarian is 3,000. Nursing, I don't think anybody mentioned nursing, but if anyone does decide to go into that field, it can vary a lot between programs, and we can definitely help you with that with more detail. Um, and then dentistry, optometry, pharmacy, physical therapy, and a lot of other fields are going to be around 4,500 characters. And then, oh, I was going to say their prompts can differ, but not too much. Generally, they're going to be, why do you want to go into this field? Pretty much. Or what have you done so far to prepare for this field, and what do you hope to do in the future? So some of them will ask more about future plans as well. Person had a question, with this character count, ideally, how many points or experiences should we talk about? I'd say at least 3-ish. For the veterinarian, probably a bit shorter, maybe just 2. But we can help you figure out how many you can fit and how many you want to fit in there. But yeah, it really depends on the field. So as I said, they're all pretty similar in prompt, like why this field, what motivates you to explore it and gain more experience, what value do you bring to this field and how can you show it, and what else do you want them to know about you? So then I kind of broke these down into a variety of different questions. These can be helpful for just brainstorming. It doesn't mean you have to answer every single question in your brainstorming or even in your essay, but they can definitely help to kind of get the ideas flowing, hopefully. So what drives you to help people? Why do you want to help people? A lot of people will start with, I want to be a doctor because I love science and I want to help people. That's great. That's a great start. But as you might have noticed with the theme that I talked about before, even though it was dental related, it was centered on education and oral health and preventative care. So that's a lot more specific than just saying, I want to help people. Um, and so you can think about, like, was it an experience or series of experiences that what made you aware of what you could do, maybe as a patient, as a provider, or as a caregiver, or something else. And I mentioned before that it's not necessarily going to be a light bulb moment, so please don't feel bad if you don't have that. Most of the time, it's something that you look back and you think, oh, yeah, I've been on this path for a while, even if I didn't realize it. Um, and who do you want to help and why? What kind of populations do you want to help? Do you want to help underserved people? Do you want to help elderly people? Do you want to help people in rural areas versus urban areas? Um, do you want to help people who come from different backgrounds? What keeps you interested in the field? What keeps you coming back, even though it might be difficult, even though your classes might be hard? Might be hard to get experiences, but you're driven. You want to pursue this field. What is it that keeps you coming back? How have you developed this interest since you realized you wanted to go into the field? How can you show your value? That would be through the stories that you tell. What have you been able to do for people so far? And therefore, what will you be able to do in your field in the future? And why this field? Why not another field? If it helps you to brainstorm, you can definitely say, well, I don't want to be a doctor for these reasons. I don't want to be a nurse for these reasons. I want to be a PA. And then focus on those reasons, like why the PA and not the why not the other things. Um, and I did mention this before, but I want to say it one more time. When you're writing about why you want to be in your healthcare field, please be careful not to criticize the field or any healthcare professionals. If you have a story that's negative, that doesn't necessarily mean that you have to not, or that you can't include it, but you want to be careful. So even if you feel like the person, the healthcare provider deserves that kind of description of their care, and even if they really do, um, it's helpful to just be more objective of this is what happened, this is how it affected me, and this is what's motivating me to go into this field. And again, we can help you with that too. Um, and then also, if you want to point out issues in healthcare or in the field today, you want to just show that you know you're going to be a part of the solution, not that you're going to be the only part of the solution. You're not going to cure cancer by yourself. You're going to be part of the team around the world, the teams that would work on curing cancer. So just being able to recognize that. And then going back to the 4 questions that I talked about a few slides ago, and to remind you of the question number 4, it is to think about anything else you want them to know about you. So this could be pretty much anything. Do you have any experience working in medically underserved areas, study abroad, research, any hobbies you want to talk about that relate to your theme? Anything about your life growing up, like this person, the hypothetical person I talked about, who maybe they had a dentist, or maybe their parents didn't realize how to teach them how to brush their teeth, and so they went to the dentist and had a lot of cavities as a, I don't know, 7 or 8-year-old or something, and the dentist, instead of criticizing them, took the time to really educate them and help them through that. That would be a valuable thing to include. Or potentially, like if they had an idea where they wanted to go into um, medicine because they had to translate for their parents when they were growing up. And what they want to do with their language skills, like their ability to speak other languages, is to create bridges for people to access healthcare. That would be very valuable to bring in. Um, I worked with someone the other day who didn't realize that they could include something like that. They thought that it was too critical, and we made sure that didn't sound too critical, but it was still stating, within the healthcare field, when people are getting like doctor medical care, maybe children shouldn't be the ones who are translating for their parents. Like we should definitely have people who are trained in translation and who know all of these terms that are going on. And so that person is going to continue with their drafting, but hopefully that'll, now that they feel comfortable including that, that'll make it a lot more personal and a lot stronger in talking about their, because of how they viewed the medical field growing up, and then what they can add to what value they bring with their language skills. And I can briefly mention this too, but not everything in your personal statement has to be directly related to healthcare, but it should be somehow related to your theme. Okay, so basic structure. The introduction, you want to catch the reader's attention with a story or idea. So that was my example before was of someone going into the dentist and having them educate them on oral health because their parents didn't know how to do that or what the importance was of that. And then they could relate that story to their interest in dentistry, of saying, based on what that dentist was able to do for me, I want to be able to do that for other people in better words than that, of course. But and then the body paragraphs are going to show the development of that theme and your interest in the field. It's going to show the connections between your experiences. So it's not just isolated experiences, it's how can you build on these? So it's kind of like the introduction is your bottom step, your foundation. The next body paragraph is a step up. The next body paragraph is a step up. So everything's kind of building on what has come before in order to get you to your goal in the future. And then the conclusion can be very short. It doesn't have to be a reiteration of each paragraph that you've already talked about because they've just read that, so they don't need that. It can really just be like 2 sentences, or even just 1 sentence sometimes of, from these experiences, I've learned the value of meeting people where they are with education, going back to the dental one, and seeing the impact that I could make on people's knowledge of oral healthcare and preventative care. And I look forward to being able to do this more as a dentist. It could be as simple as that, again, in better words. I'm just making this up as I go. So reflecting back on everything that's come before and then look towards the future as a healthcare provider. Any questions here? So just a brief description or a brief discussion of what you can put in your body paragraphs. I definitely recommend having a transition that shows purpose and intention, because instead of saying, I then found myself working in the ED at UCDMC, where nobody just picked you up and put you there. Like you applied for the position, you interviewed for it, you may have written some essays for it, you did it on purpose. So what was that purpose? So I have an example here, like because Dr. Perez showed me how important it is to make these connections with patients, I decided to volunteer in the ED at UCDMC where I was able to talk to patients' families. What did I say? And comfort them. So we can conclude from that the previous paragraph was about connections with patients and Dr. Perez. So then they're drawing that information into the next paragraph and kind of putting that story forward of I took what I saw there and was able to do it here. And then this person's going to tell a story about talking to patients' families. So tell the specific story, keep a balance between talking about someone else and talking about yourself, because we don't just want to know about the patient or just know about the patient's family, but we want to know how did you get to help them feel comfortable? Even if you're talking with them and you think, well, anybody would have sat down and talked to them. Unfortunately, that's not the case. Not everybody is open to talking with people or friendly or easy to approach. So what is it about you that helped them to feel like they could open up? I had, this was a long time ago, but I had someone talk about how they tried to reach or be able to talk to someone and the person really wasn't interested. And so they noticed that their hat had a sports team on it that they also liked. So they just said, oh, I love your hat. That's my team too. And then that just opened up a conversation. So if you're thinking about it, like not everybody would have thought to do that. And so that person's ability to make a connection in that way was important. And it shows how they're going to be with their patients in the future. And again, you'll be able to show how you embody those core competencies and the values of your healthcare field without saying them directly. And then it's also important at the end of the paragraph to tell the reader why the story is important. So we have the show with the story, but you need a little bit of tell so that the reader isn't left trying to figure out why you told that story. And it doesn't have to be like you're hitting them over the head, like, and this shows that this. but it's kind of like, why is this important? What do you want to be able to do with this? Maybe, so this person is, this example that I had at the top of the page, this person talked to a patient's family and they, um, were able to kind of distract them for a while and help them feel more normal, maybe explain a few things about what was going on with their relative. And at the end of that paragraph, they say, I realize the importance of connecting with people in this way, and I look forward to being able to do that plus provide treatment in the future. So that goes back to why medicine, for example, with this one, or why whatever field. Like, I want to do what I've been able to do already and then more. Then I want to be a doctor so that I can provide treatment and diagnosis, um, and be able to connect with patients' families. You've already worked through this part, which is great. You already have these experiences. You already have the skills to talk to people and help them feel comfortable with you, and you're going to add more. Okay. I had another idea. Now I forgot what it was. Maybe it'll come back to me. Okay, so then some other things to keep in mind for most of these healthcare fields. Keep things general and avoid being specific about any schools. So for medical school specifically, also for dental school, for PA school, and a couple of other fields, you have one main application that's going to go to multiple schools, but the main application is what you're applying to. So you write an essay of why you want to be a PA, and then every school is going to get that same essay. So you don't specify it for one specific field. That said, some application systems do ask you, or some fields do ask for specific personal statements for their schools. One in particular is nursing. And so that's where you'd want to write them for those specific schools. But if it's something like medical school, you're going to have a chance to talk about why you want to attend their schools in the secondary or supplemental questions that'll come later on. Again, when deciding which experiences to include in your personal statement, keep in mind what schools in your field look for in applicants, like these core competencies I mentioned before. You don't need to address all of them. That would be pretty awkward, especially if you address all of them just in your personal statement. But you do want to address the main ones that you feel are applicable to you, the ones that really highlight your strengths. And then one thing to mention too, when you're talking about patients you've worked with, we do recommend having a name. So if we're talking about like this experience where this person's talking to a patient's family, maybe they give them a fake name, or they would want to give them a fake name. You don't want to use real names. And the first time that you use that fake name, you put it in quotes. And then anytime after that, you don't need to. So I have an example right here. And the reason why that's important is to make it more personable. It just makes it a better read for the admissions committees. It helps you feel a little bit more connected to the story, even though it's not a real name. And if you're getting close to the character count, you can always choose a really short name like Tim or Anne. And a few other things. Most important is to follow directions. Of course, length, word count, character count, page count, everything like that. Break down the prompt into a checklist if there's more pieces to it, if there's several pieces to it, not if it's just why this. When brainstorming, try not to edit too much. Like when you're typing out things, don't worry about the character count, don't worry about grammar, anything like that. Just get your ideas on the page and work from there. And another reason for that is that even if you don't use something from your drafting of your personal statement, in your personal statement, you might use it for an experience description or for answering a supplemental or secondary question later on, or even preparing for your interviews too. So writing is not going to go to waste. If you end up writing a whole bunch of things and not using some of them for your personal statement, that's totally fine. Just take them out, put them in a separate document and keep them just in case you need them later. Start writing early. Leave yourself a lot of time to write multiple drafts. Use all the resources available to you. and I like to say this too, start writing anywhere in the essay. You don't have to start with the introduction. You don't have to think of like the mic drop kind of introduction right away. It can be, you can start with a story that's going to be a body paragraph, or you can start with the conclusion if you wanted to. However you want to start, don't feel like you have to start writing with the introduction. And then an editing tip, try reading your essay out loud to yourself. Sometimes when we're writing and reading things silently without speaking, we can kind of gloss over things a little bit. But when you say it out loud, sometimes you think, well, that doesn't sound right. So that can be very helpful. Okay, does anyone have any other questions?
I have a question. I was mentioned all the experience, and I was wondering if like the public health experience that I was talking about and like the occupational health stuff, it
Mhm.
was in direct patient care. Would that count for the 1,000-hour requirement, even if it was in the military?
Are you planning to apply for a PA?
PA school, yes.
Okay, sorry. I think you mentioned that earlier on. Um, it depends on what you did in the position. So it would be like, were you hands-on with the patients or with
Yes,
patients in general?
absolutely. Yeah,
Okay.
absolutely. So like a lot of them, like preventive health assessment is basically like a pre-questionnaire before they go see a doctor 30
Hmm.
minutes later. So they would do like we would ask them about like their mental health and their general health in general. Like we would do patient histories and medication and blood pressures and all that stuff. And then um, the doctor would see it and then they would make a follow-up appointment with them. Depending on their answers, they might even get sent to mental health assessments and sometimes even emergency interventions through mental health or a provider.
Hmm.
And
Yeah, and
basically
I
all of
think that
that.
could definitely count. Yeah.
Okay. And how would I capture that if like I'm not sure that my military uh, exit paperwork has all that information in there. How would I capture all that to ensure that it counts?
Well, you're going to report your experiences in your application, and then you would just state whether this is a direct patient care experience or a more generic healthcare experience. So it's going to be based on your own word, basically.
Okay, thank you.
But you are going to put like contact information. So then if they have questions, they could contact people. They may not necessarily, but you're going to say where you got that from so that they could verify it if they need to.
Okay. And like um obviously in the military, like all the contact people that they move around. So who would I put as a
Mhm.
contact? Like,
Anyone who could speak to the fact that you were there. So if
okay,
it's like the current supervisor or current leader of that division or whatever, you can usually put them because there'd be some kind of file somewhere that would say, yes, this person was here from these dates to these dates.
okay. Sounds great now. Thank you.
Yeah, no problem. Any other questions? Well, thank you all very much for coming today and asking great questions. I'm going to stop the recording.
Now, um, I also